Obrigada.
Thank you for being with EHEALTHSUMMIT.PT 2021. We're now address a topic that concerns everyone, which is vaccination, also digitalization of this vaccination against COVID-19 in Portugal. Something that has, of course, been complex and created many hopes, and it has required a joint effort by several entities. And to talk in this panel, we count on the Vice-Admiral Henrique Gouveia, who coordinated the task force of the vaccine. Graças, the Health Director General, António, Vice President of Infarmed, and Luís Pinheiro, Chairman of the Board of the Shared Services of the Ministry of Health, and also Paulo Sousa, President of the Common Use Service of the hospitals. Vice-Almirante, I would like to start with you. What has been the major challenge of vaccination? Well, vaccination is a complex process because it's massive and very pressing at the same time. One of the major challenges to do this process in an orderly and controlled manner. It isn't easy to vaccinate on average between 80,000 to 100,000 per day, which is what we have been doing, what we're doing so far. And so to summon people orderly, to have the logistics all ready to enable the vaccination process, to vaccinate and then do all the recording of that process, it's quite complex. And it requires many intelligence information services. What technology? How has technology been used? Well, the technology is like a body, had a central nervous system. The technology is the central nervous system. I often say this SPMS system is the central nervous system of the body, of the vaccination body. If that technology wasn't there, if those exchange of data and the exchange of information wasn't there, the scheduling was not done in a coordinated fashion and structured way, it would be very hard to do all of this. The body could fall apart quite easily. So the digital systems are basically the nervous system that convey the orders, the commands, the instructions, the data, and everything that has to do with the activity pertaining to vaccination. Dr. Graças, Freitas, you mentioned a while ago, we have to keep on talking about the present reality of pandemic, while aware of the steps that have been taken to put a break to this pandemic. Vaccination is surely one of them. What is your balance of vaccination in Portugal? Well, good morning again. Well, I would like to recall everyone that today's the World Day of the Child, and we are to be congratulated because last year, the year of the pandemic, when so many things were left behind, we didn't stop vaccinating. The rate of vaccination was 99% in the first year of life, the first ever. So thanks to vaccination and not just that, monitoring of pregnancy, labor, and of the children that we never stopped doing. Also last year, we are to be congratulated, we had the lowest rate of mortality, child mortality ever in our country. 2.4 deaths per birth. It's never been so low in spite of going through this malignant year. So the National Health Services, its professionals were able to keep their activities of prevention and protection of health, and that is very good. And to answer to the present, I'll go back to the future. In 1965, we had the national vaccination program, and it didn't have the technology, but it had everything there already. It had the nervous system that was already thought through. Who did it map the country very well. There were points of vaccination. Here I'm talking to people who are coordinating the logistic. Everything, all the points were laid down. We knew where we were, how many diseases we had, where we wanted to go to, how we wanted to go to, and in which way to take. So this service that was provided to the country, the National Vaccination Program, was the precursor of the COVID-19 vaccination. Now, the first year when we vaccinated in Portugal in 1996, 3.5 million doses for polio were given, and children from 0 to 9 years old were covered. So there's a technological, logistical area that has been extraordinarily well developed at this stage of the pandemic. The balance is extremely positive, but we have to see that we had a solid basis. We had a very well-organized nervous system, and now, luckily enough, technology has made easier. So, what the balance of this anti-COVID-19 vaccination, I think, is a positive one, because it allowed our president or chairman to speak about COVID in the past, and I've been saying this in the past few days. That has to do with a lesser impact of the disease on mortality and the seriousness on the dropping the number of cases. So the balance is clearly a positive one. And of course, here technology has immensely made our path much easier. Thank you, Dr. Faria Vaz, Vice President of Infarmed. Of course, when we started talking about the vaccines, many doubts arose. There were many issues. We had to trim down a lot of information regarding the number of doses and regarding the vaccines that were being developed. Was the role of Infarmed, and how was it possible to control some instability so that the process could move on in a more secure way? Well, I would like in the first place to greet my colleagues here in the panel, and also the people who are viewing the live stream of this roundtable. Well, I'm representing the Infarmed, and I think this joint effort has been one of the most challenging experiences for any one of us in our lives. The digital transition was largely something that was incipient until this pandemic came about. There were many initiatives, but in various organizations, but they didn't mean a radical change in the way we communicate, interact, buy or work, and the way, in brief, as we live. COVID-19 was therefore more effective than any expert or futurologist to operate this digital transition. Nowhere did this digital transition proper of re-engineering of the digital transition remains, and I hope it will remain so. From the human standpoint, it was very significant also. The advantage of having a technological approach, a very sturdy one, is obvious today. I would like to quote two examples. Globally, 1,000 million, the dose 1,000 million was produced on April 12. So we took a little over 6 months to produce the first 1,000 million vaccines. On the 7th of May, only a month and a half later, the unit had produced 1,000 million, and the next 1,000 million. If we want to look at the vaccination rate, all we have to do is look at how it accelerated. We began vaccination on the 27th of December 2020. At that time, we had 0 doses. 5 months later, we have 27 million doses that were given, and 1.67 million were second doses, a process that typically would drag on and now it has materialized in a country like Portugal. The exponential nature of these trends cannot be underestimated, no matter how much we want to. And it's important to think that that would not have been possible with highly evolved technological devices. We believe that this change in paradigm, let's think of the Spanish flu that took place only 1 year ago, and that harvested by far many lives. The first studies from the United Kingdom point to at least 60,000 lives that were saved between February and May by vaccination against COVID-19. I would like to tell you that the digital transformation and the role of Infarmed was expressed in various meetings, weekly meetings at European level to debate the aspects of monitoring and ensuring the assessment of the time that when the vaccines entered the market. But we also like to say that the process of research and assessment of these vaccines was entirely innovative. And once again, we owe it much to the digital transformation. We moved from an assessment that would never last less than a year and a half to an assessment that lasted less than 2 months. This is unequivocally ensuring the security and the effectiveness and the quality of the vaccines. Allow me to conclude the supervision, human control of the decision must be ensured in all these moments as a guarantee that the technology serves humanity and not the other way around. Thank you very much. Thank you, Dr. António Faria Vaz, Dr. Luís Vaz Pinheiro. In fact, technology, the digital solutions were crucial to speed up this whole process of vaccination. It's true if we bear in mind that since the 27th of December last year until now, over 5.5 million vaccines were administered in Portugal. And the context was not an easy one because we well know that technology here had to make sure or help ensure the following final outcome. We have to vaccinate between 15 to 18,000 inoculations in the shortest period of time possible. And what we all want is that it only depends on the arrival of suitable vaccines. That's the role of technology to support us in this. And it's not an easy task because we have to call people, we have to monitor the entire procedure, we have to record inoculations, we have to also communicate with people. And the context is not an easy one. There was a lot of great fluctuation, made a lot of changes in this process. The vaccines don't always arrive at the pace that is expected, and oftentimes we know what happened with some vaccines that we were counting on, and they had suffered adversities that were and limited them to some age ranges. So these were changes, the modifications that emerged throughout the whole process, and this also impacts with the creation of information systems that need to help to conform this, to mold this process, to be aware of what we have in place. The systems, as the local clinics, about 360 database, they allow in a local base of over 200 healthcare units to do their work of identifying people and call them to be vaccinated. It is also possible to help these healthcare units to find the people who were on the priority lists and were identified here by the DGS because they were researchers on the database of the health system, national health system, and also with the use of national electronic prescription so that the doctors could help the patients to be on those lists, those priority lists. We were able to send over 2,366 SMSs asking people if the date that they were summoned for was suitable for them. To there was this vast set of new vaccination stations that were created, namely that are those that are served today by S Clinic Central, a tool that emerged during the vaccination process, and in many cases allowed for the IT health network to be installed, and in over than 150 locations, many with optical fiber. And the participation proper of the citizens in self-scheduling, with over 720,000 people resorting to the portal in one way or another to schedule a vaccine for themselves. The recording in the vaccine system that allowed to record 550,000 doses, and also business intelligence allowed to monitor what's going on and help the decision makers, such as the task force, deciding on the same topic, or the systems that were used for communication systems, simulators where people could simulate and over 6 million times that they were used to verify if they belong or no to some stage of vaccination against COVID-19, or the possibility of going to the portal and change their data and use them. All these systems were created in the past 5 months. These are 5 months that look like 5 years, it's a fact. But they were 5 months, and in large part the systems started from pre-existing infrastructures in the National Health Service, and namely SPMS, but most of them were new systems. And over the pandemic, they have been put at the disposal of those who every day vaccinate people at vaccination stations, those who on an everyday basis coordinate the process in the context of the task force, and those who on a daily basis deliver the vaccines where they have to be delivered to, and those who on a daily basis take decisions on the vaccination procedure in various natures, such DGS, Infarmed, Dr. Paulo Sousa. This whole process of logistics, distribution, and so forth was one of the major challenges. Is it still one? Yes. It is still one of the major challenges. I think it's a challenge that is more or less won and on the right track. It will surely hit the administration of the vaccines. I think it's also on the right track and on the way to being a success. But when it comes to the intervention, which is the distribution of vaccines, we were not prepared to this major task. At the same time, we were setting up or finishing to set up a logistical station that already had refrigeration and freezing appliances. And because of the vaccines and the first ones, we acquired an infrastructure with ultra freezing devices. And from that point on, the decision of the ministry, the moment it came up that an Infarmed and the health direction, when we were given this task, what was really hardest was how to store them. We didn't know the vaccines that were coming in. Some were not approved. We knew the one that was the first to arrive. We didn't know the total or the total requirements of storage, of how to receive and transport. It was not easy to grasp all that. It started more or less on the 1st of November last year. And by the end of March, April, it's become stabilized. What more vaccines may come up, but the knowledge we have of these requirements of the current vaccines that are being used will make our task much easier. Now we're at a pace of distribution and receiving and storage and distribution that is very interesting vis-a-vis the early days. At first, we were learning. Just to give you an idea, we distributed at some point 2 bottles in vaccination centers, just to ensure a small distribution that was an equitative one. Now we distribute full cars, full loads of vaccines. We learned that was going on. We were not ready, but obligation and necessity made us sharper. So I think it's this is a victory, and we don't expect to find any other obstacles. At what stage are we now? What's the message we should convey? Well, the main task, I would say, in our intervention, we ensured what the planning and the task force, the cabinet of the Secretary of State set out as the amounts that should be placed at every station every day. And there are work, from what I know from that planning, that is currently also being made, not on a daily basis, but quite ahead of time. I think we've had the best month of vaccine distribution, the largest months. And well, it's going to be the one who starts today. From this point on, we'll have good months ahead, but it will be peaking. The peak of arrival and distribution of vaccines is actually going to be June. And from August on, I think the task will always be going downhill, decreasing. This is what we're foreseeing. Our team is built, and we'll make sure they will continue to do so. We will not waver. Vice-Almirante Gouveia, Melo, this is a new month, the month of June, and it will be another stage in this vaccination procedure. What message do you want to convey to people, and what is... When we talk about vaccination in Portugal, well, this vaccination process has been a long staircase. Every time we move a step, we step on one step, there's always another one ahead. And we're at a stage where we're still going upstairs. In the month of June and July, we'll have the highest rate of daily vaccination, about 100,000, or in some days above 100,000 vaccines per day. We're still not seeing the end of the staircase or of the ladder. We've produced about 5 million inoculations. We're going to administer about 15 to 17 million inoculations until the end of the process. We're about 1/3 of the way. We've already did something which was very relevant, which was to protect the elderly. And it's visible that we have decreased the rate of deceases and confinement to hospital. These results are visible. Most cases were above 60 years old, and now we have to move on. There's still many millions of people to be vaccinated, 2 doses, most of vaccines. And as you said at the beginning, it has to be systematically and orderly the way we do it. It would be very easy to say, well, we have vaccines, come and take it. That would bring about a gigantic lack of organization problem. So these procedures that were mentioned here are IT or digital procedures that are very very relevant for this planning and the way we move on. It's only the planning of a matrix that has to attribute vaccines every day to a vaccination station, and the stations have different needs every day, and adding the logistics of the vaccines and the ability to administer and schedule vaccinations in an orderly way without having it all fall apart. This is a huge task, and this one step we have taken forth, and we go up every day that ladder. Today is the International Child's Day, and this is universally where where knowledge is shared and encouraged. So what are the lessons learned for the future generations from this pandemic and this major national and global effort around the pandemic? Dr. Graças Freitas, well, I would like to think that science and knowledge and obviously technology were at the source of what we now achieved with vaccination. Dr. Faria said it very clearly. So it was possible in absolutely record time for science to allow the manufacture of vaccines that have characteristics that we can never abdicate. They have to be safe. That's the first rule. We vaccinate healthy people. They have to be effective. They have to produce some effect. And altogether, they have to be safe. So it was science and technology, including, of course, IT technology, that allowed for vaccines to come about with these characteristics. Without vaccines, there is no vaccination. This is the first major lesson. It's what science has given to this pandemic. The second topic has to do with planning and organization. And I think that all those who are here today, all the nurses, doctors, all the people in vaccination stations, health centers, the situation rooms, they have an immense task at hand of planning and achieve good results regarding the vaccines. We have learned we are being ever more effective in making vaccines available. But here's my great call is to those people who let themselves be vaccinated. Planning, technology, everything would be completely useless if our fellow citizens did let themselves be vaccinated. So as we move away from the population that suffered more from the pandemic, who got sick and died, and as we move closer to younger generations, we have a lesser awareness of that risk. Well, I call upon all those younger generations to be vaccinated. It's the only way of protecting themselves and the group and the community that they belong to. And I cannot resist I can't help but quoting Arnal Senpai, who said there's only three purposes in vaccination, and the three are to vaccinate, vaccinate, and vaccinate. So I call upon all citizens to continue in this endeavor of being vaccinated. And I thank all professionals who over these months have made a huge effort to make available, as was mentioned here, and administer thousands of vaccines in such a successful manner. So these are my 2 cents. Thank you, Dr. Bessa Freitas. Dr. Faria, a final remark. There is nowadays different confidence and trust that has been working upon, and the relationship that people have with the vaccines. Well, allow me to answer to the question that you just posed. Luckily, like Dr. Graças Freitas said, we have a history and a culture that are specific, I would say, worldwide, as regards vaccination and the trust that we as citizens have on the vaccination plans. Only that can explain we are the only ones, we are unique in this process. Vice-Admiral told us that the rate of vaccination in healthcare professionals was extremely high, and in some cases reached around even 100% of healthcare professionals, meaning that healthcare providers, as vehicles of trust for citizens, they consider it that these are trustworthy technologies. Allow me to add a few notes to this process that I think are important. In the first place, and that's what we're talking about, of digital transformation in the context of the pandemic and the vaccination for this disease, I would like to say that behind all this movement lies an immense body of work of healthcare providers, technicians who have allowed us to manage intelligently this whole procedure. And it is necessary in this context not to forget that this was possible, this organization and this way of working became possible by using technology of a digital nature. We must keep in mind and not forget the large number of meetings that the National Direction, Health Direction, INSE, and Infarmed conducted over this period of time, so as to raise the awareness vis-a-vis procedures and to modulate the parameters for vaccination in this plan. It is also important not to forget, in the context of the digital world, the crucial role of the SPMS had during this whole process. SPMS is today the fundamental pillar for digital transformation, and to ensure that we are able to monitor the security and efficiency of the COVID-19 vaccines. As very recently, we had the chance to know about the data of monitoring the efficiency of the vaccination. That is possible because SPMS created the conditions to join the information from several databases, and based on that information to monitor in real time the efficacy of the vaccines. So I would like to enhance this aspect. As also mentioned, it's also been crucial the support of SUSH in this whole process, also with the digital transformation, and the role of the Vice-Almirante has had in bringing forth and materializing the vaccination plan. Thank you very much, Dr. António Faria. Before closing, I have to pass the floor to Dr. Faria and Paulo Sousa. To close this panel, Dr. Luís Pinheiro, you mentioned that technology actually became a very important ally at this stage, and many of this technology and mechanisms were pre-existent, but everything had to be accelerated. There are some important lessons learned for digital health. Yes, of course. All the novelty require some thought and looking at the future. Over this pandemic, all the work that we did, there was a component of trying to look for solutions for the present, but can also have an impact in the future. It also happened as regards vaccination. We have tried as much as possible to test some solutions. For example, as regards contacts with people, that can be very important tools in the future to bring people closer to SNS, to National Health Service. We have tried, and the way we relate with the services of the health ministry and close to the health ministry, it makes us think on the ways how to find a solution, so that we can all work in a more integrated manner, sharing information with more knowledge and more effectively. And on the other hand, we also necessarily had to speed up the process, the evolution processes that will take some time to slow down. So from that standpoint, we should all benefit from this acceleration wave of permanent innovation to, in a very swift manner, build up the upcoming times as regards digital transformation of healthcare. We all expect it to be a part of PRR, and with this acceleration of the vaccination process that the COVID-19 brought to information systems very quickly, we hope that they can produce results that can be perceived by citizens, because at the end of the day, that's what it all matters. Dr. Paulo Sousa, do we have a structure that allows us to respond more quickly than a year ago? Yes, it's at in the DNA of SUSH that will be 57 years soon, to design or plan program solutions as we come to know about the needs of the hospitals, but it's also in our DNA to respond, improvising solutions when it's necessary. This was not planned. What happened? We had to plan it while it was ongoing, and it forces, as I would say, to sharpen our capabilities and all the logistics that is carried out by SUSH, including this one, will produce a good transformation with the experience that we're gaining from this vaccination process. What Luís Pinheiro said, well, we also had to improvise to design a portal that could be accessible to all the agents in the vaccination plan, vaccination stations that need the vaccines, and even the commanding room that coordinates, and the storage and distribution. We had to monitor distribution because of the temperature and the highest, the peak of the traffic circulation, and we had to calculate the transportation time. We were forced to really adjust to this need, and we understood that will help us in all the logistics of our service. Besides vaccination, we have a lot of logistical activity that we carry out in hospitals, and I think we're already evolving and moving forward and using that knowledge for other activities that we carry out. This is the way we go on, and we'll come out of it much stronger. Thank you very much to all for being here in this major event on digital health. We will have a small pause. We will come back and to address another topic on digital health, e-health in Portugal.